Waseem, Pediatrics, one of the pediatric series. I'm starting with the colic, which is quite a common problem. I will do it in a series of short videos. So let's do the first part. Colic usually means excessively crying baby who is very irritable, not sleeping well, often not feeding well, lots of screaming, gas, bloating, noise in the tummy, and many sleepless nights for the parents and the baby. I'll begin with that. Usually the history is that the first 2 weeks were usually peaceful and there were no problems at all. There is a reason behind that, and I'm going to talk about that today. At birth, there are two gifts given to the mother in the form of, one is jaundice, which is not always visible, but all babies universally are jaundiced. It's just their level sometimes is not high enough to show in the skin. And the second problem is the storage of food in the liver of the baby. These two factors lead to a very peaceful and calm period of 10 to 15 days after birth, and I think nature intended this to give rest to the mother after such a long pregnancy and going through the extremely difficult delivery or sometimes cesarean section. This fact is often not realized. The jaundice, how does that play a role in the calmness of the baby? Babies are born with very high hemoglobin because inside the uterus they are in a low oxygen environment, like they are living on a high mountain. So they recruit a lot of red cells, and their hemoglobin is often about 1/3 higher or half higher than an adult hemoglobin, which leads to quite a significant thickness of the blood flow. Once the baby is born and the lungs take over the function of oxygenating the tissue, that hemoglobin excess is not needed anymore, and it has to be rapidly dropped down over the next 10 to 15 days. When the red cells start breaking down, they release the hemoglobin, which gets converted to bilirubin. The liver is not ready for it. The liver cannot release it or completely excrete it outside the body very quickly because it's a new job for it. So the bilirubin level rises, sometimes to a very high level that becomes an emergency. We put the babies under phototherapy lights, or sometimes we do measures even more severe than that. The benefit of bilirubin is it's a sedative. It makes the baby sleepy and calm. You may have seen, if you have had the misfortune of a liver disease patient who is in advanced liver failure stage and very yellow and jaundiced, they usually become sleepy or unconscious. That is the effect of the bilirubin. The liver takes about 2 weeks to learn the tricks of removing all the bilirubin, and within 2 weeks, subsequently, there is no further need to further lower the hemoglobin, so that process stops. The two together lead to a lowering of the bilirubin and sudden alertness of the baby. The baby doesn't have now that sedative and starts becoming demanding, wakeful, fully alert, and often not able to sleep as peacefully as is used to, and that's also not liked by the baby itself, most likely. The second factor that leads to the calmness of the baby is when the baby is born, the baby doesn't feel desperate for food, because in the last 5 or 6 weeks of pregnancy, the smart baby usually stores quite a lot of raw sugar supplied by the placenta into its liver and tissues, being ready just in case the mother doesn't have enough breast milk supply. So usually in the first 4 or 5 days, babies suckle only a few teaspoons of milk. That supply keeps sustaining the relative lack of breast milk and the fact that the breast milk is very light initially to sustain the first 14-15 days for the baby. When the supply runs out, again the baby starts looking for food, and that is the exact same time when the bilirubin has been excreted out of the body as well. So the two together make the babies hyper alert. This explanation helps the parents understand how the transition happened and how the baby suddenly changed from one behavior to another. Because often when the baby starts crying and becoming hyper alert and not sleeping very well, most of the relatives or friends or parents themselves just simply reach the conclusion that this is lack of breast milk supply, or we are not feeding enough, even though they're bottle feeding and they're actually giving more feed than they should be. I'll talk about that in the next clip. Keep tuned.